for millions of people, myself included, folks, living with knee osteoarthritis, living with chronic pain, is awful. I speak from experience. Medications and injections, massages, joint replacement, chiropractic, some physical therapy, perhaps. Well, it's all been the norm for folks like us. But now there's a new minimally invasive procedure offering hope to patients who aren't ready for surgery or maybe can't have it for other reasons. Rutgers Health and University Hospital in Newark are among the first academic medical centers in our region to offer genicular artery embolization, or GAE. Write that down, GAE, to reduce inflammation and relieve knee pain, all without surgery. Dr. Abhishek Kumar is Chief of Interventional Radiology at Rutgers Health and University Hospital. Sign me up, Doc. Good morning and welcome, Dr. Kumar. It's good to have you on.
Good morning, Ken. Thank you for having me on.
You bet. I am literally, I have to my right a knee brace. My right knee is swollen like a balloon. My patella is loaded with arthritis. I'm a mess. Describe GAE and how it can help relieve chronic knee pain for folks like me.
Yeah, so GAE, or genicular artery embolization, as you said, is a minimally invasive procedure. It's not surgery. It's a procedure we do under X-ray guidance. And rather than replacing the joint itself, what we do is target the blood vessels that cause inflammation in the joint. So when you develop arthritis over years, what happens is the blood vessels around the knee grow. So you can sort of imagine branches of a tree sort of growing out of control. And these new blood vessels is what the body uses to send the molecules to cause stiffness, swelling, pain. And what we're doing is just trimming these branches by injecting some tiny beads so we can reverse that process. We do this as an outpatient procedure. You come in either to a office-based surgery center or the outpatient department of the hospital. We put you on an x-ray table, we numb up your thigh, we put a tiny catheter in the vessel under x-ray guidance, about a width of a spaghetti noodle. We inject some dye, take a look at these new vessels that have formed, and then we inject these beads to sort of quiet down that inflammation. Procedure takes about 45 minutes and you're home in a couple hours.
I love it. I love it. What about I have AFib, so I have to take Eliquis. For those who take blood thinners, Coumadin, Eliquis, Xarelto, etc. Does that impact that at all? Or now does that make us not a candidate?
Uh, Not at all. I think since the incision is so small, the profile of the catheter is, as I said, a width of a spaghetti noodle. It's very safe in patients, who are on anticoagulation. Occasionally, for certain patients, if they have a large body habitus, we may have them stop the anticoagulation for a day prior to the procedure, but they can resume it the day after.
Right. I just wasn't sure if someone who takes a blood thinner on an ongoing basis, if that defeats the purpose, because I know that in my case, they went to, and I'm sorry to make it all about me here. They went to drain some of the fluid from my knee, and every time they went in there, they were pulling out 100 cc's of blood. And then they realized, well, you're gonna have to get off blood thinners for a little bit to let whatever it is in there heal. So I'm just thinking, whatever impact it might have on your procedure, if it might be something that somebody on blood thinners might have to talk to whoever prescribed the blood thinners to make sure that
Right.
the two
Right.
are
So
not.
it's always a good idea before you stop any blood thinner to speak with your doctor who's prescribed it. People have blood thinners for different reasons.
Right.
However, being in a blood thinner does not change the efficacy of our procedure. So these vessels we're targeting are tiny. They're, fine and, a few millimeters in size. Once we block them, being in a blood thinner is not going to be able to open them up. So once we block them, they're going to stay blocked for quite a while.
I love it. Now, what about somebody though who's like bone on bone, or who, their meniscus is torn or whatever? Are those circumstances kind of out of the picture, or can this also help people like that?
So it can certainly help people like that. What it is, this procedure is not a sort of alternative to knee replacement. So, it doesn't grow back your cartilage. It's not going to, replace your joint. But what it can do is sort of serve as a bridge. So, I see patients with bone and bone arthritis who are just not quite ready for a knee replacement yet. And this procedure just sort of buys them time. It could give them a couple of years before they're ready for a knee replacement. Oftentimes there are patients who have that severe arthritis, but They may just not be a candidate for knee replacement, maybe because some other comorbidities they may have. In those patients, this offers some pain relief and functionality.
And hey, if you get 5% pain relief, it's something, right? As long as you end up a little bit better than before, you're in good shape. That's a great thing. And this is performed by interventional radiologists. For those who don't know what that is, explain what an interventional radiologist is.
Yeah, so it's performed by interventional radiologists. So interventional radiologists, such as myself, are basically endovascular surgeons. What we do is perform procedures throughout the body using imaging guidance, and that's where the radiology comes into play. So we use ultrasound, we use X-ray. Wherever the blood vessels go, we can go there. So through a tiny pinhole in your wrist or in your thigh, we can enter the blood vessels that go in the body. With that, we can go up to the lungs to take out clot. We can go to the liver and treat cancer. We can open up blocked arteries in the leg.
That's amazing. Because I've had my heart. What do they call it when they take a look at your heart going through your groin area? I forget what that's called, but with
Coronary
the
intervention,
cardiac. Yes,
cardiac
so
cath.
I've had that twice. I've had that twice, and it's just amazing. You feel nothing. You feel nothing, and it's amazing that they don't have to cut you open to look. It's a lot better. What does recovery look like, Dr. Kumar?
So recovery, I basically tell my patients, take it easy for the next 24 hours. What that means is stay at home, no exercise, no heavy lifting. But usually everybody is able to get back to normal activity within 24 hours. Again, it's an outpatient procedure, so you're not being admitted to the hospital. You're leaving the our outpatient center with literally a Band-Aid, which can be taken off in 24 hours. So very minimal recovery when you compare it, obviously, to more invasive surgeries.
That's amazing. That's amazing. And when do they start feeling the relief? Is it fairly quickly, or does it take a few days for the relief to start to kick in?
All our clinical studies say to assess the relief in about 2 to 4 weeks. But I'll tell you, there are patients I see who, in a couple of days start feeling relief. So it does take a couple of days, but as the inflammation calms down, you should start feeling relief. Another important point is that the relief tends to get better as time goes on, as your body starts getting used to sort of, less inflammation there, improved functionality, being able to sort of climb upstairs. Patients report that quality of life has actually gotten better as time goes on.
Amazing. Doc, what's a website for more information?
You can go to Rutgers Health and just search genicular artery embolization. You'll find me on there, and there's plenty of information. There's a Society of Interventional Radiology. They have tons of information on minimally invasive therapies that we offer, including genicular artery embolization.
I love it. It is called Genicular Artery Embolization, GAE. Dr. Abhishek Kumar, thanks for coming on. We appreciate you. And we're
Thank you
coming
for
right
having me.
back.